anyway? Whose fault is it anyway?
Very good morning, fellow Toastmasters and distinguished guests.
Good morning.
It was just another day in my work in the bustling hospital, me rushing between ICUs, doing my usual bedside ultrasounds and procedures. I enter into the liver transplant ICU, where I see two patients with contrasting histories but a very similar unfortunate prognosis of a disease. It is chronic liver disease or decompensated liver disease. In this, your liver fails completely, and because of which there's accumulation of toxins and poor production of the necessary enzymes in your body. I see a woman who is very thin, friable, weak, malnourished, with a large fluid-filled belly. Her skin is papery, her eyes are yellow. She is incoherent and confused and working in pain, rolling in her bed. She was suffering with hepatitis-related liver disease. Just adjacent to her, I see a very elderly, pompous politician surrounded by vociferous crowd who didn't give a damn about the decorum of the ICU. He was suffering with chronic alcoholism-induced liver failure. Both of them was in line for liver transplantation. It was only after a second look at the woman, who I could barely recognize at first, it stirred me into my memories of my medical school. She was once this prim and properly dressed, plump individual who always had this tireless smile on her face. She was meticulous and she was always compassionate to her patients. She always believed in the fact that she has to give her best to her patients. And despite the fact when a patient lashes out at her, she would ever calmly respond back, because she always believed the fact that they were exhibiting their worst only because of their illnesses. Yes, she was Anjali, a working practicing nurse and the best at it. She realized she had overpowering responsibilities but very little authority. It is from Anjali that I learned that the most essential facts in what a doctor has to follow. There is patience, empathy, and compassion to the patients. We learn a lot of things in medical school except these. It would be in terms of skill set and in knowledge, but hardly anybody teaches us how to behave with our patients. This is something I learned from her. I also learned the fact that we need not always be right, but kind, and always give the benefit of doubt for if they are right. It was heart-wrenching to see someone who is such an able caregiver such as Anjali right now battling death with hepatitis. It also draws to the point that life is so uncertain, and who am I as a caregiver to decide as to who deserves a better life? Is it Anjali, who accidentally had a needle prick from a patient as an occupational hazard and is right now suffering with hepatitis-induced liver failure? Or is it a person who indulged in chronic alcoholism and is suffering from liver failure? Both of them are patients and both of them are facing the same doom. But howsoever, a politician here, being the man with the big bucks and connections, definitely bypassed the transplant waiting line. And though he was enlisted some 3 to 4 days ago, definitely gets a transplant liver right waiting for him, and she is left to the clutches of death despite waiting 6 months. Despite being emotionally disconnected with your patients over years in order to maintain a calm judgment and not cloud your judgment, it really hurts deep down to see someone who is so close to you, who meant a lot to you, who taught you so much, to be breathing with pain and undergoing what she is right now. It almost makes you want to forego your medical ethics or your moral ethics in order to provide services for her or defer services for the other person. But it is at times like these that her lessons are of utmost importance. That life is never going to be fair. We have to face it, that life is never going to be fair to us. It always rains the hardest on the person who deserves sunshine. And despite the fact that life is going to be throwing walls around you, you have to dream anyway. Despite life and destiny dawning you in misery and sadness, you have to smile anyway. And it is not often that we come across people who are so minimalistic and inspiring as herself. And she definitely stood by the example that the best way to find yourself is to lose yourself in the service of others. And it is pointless to simply adorn them and not actually follow them. So today, I looked at both my patients and gave my best to both of them, smiled at both of them, and provided my full service to both of them, just as I would have with any other patients. Because I have come to accept that I will give my best and life will go on anyway, because whose fault is it anyway?